Assalamu alaikum warahmatullahi wabarakatuh. Welcome to the 9 p.m. English News Edition. Here are the top stories. Chinese medical experts visits in Arta. For the international news, millions of children at a risk from COVID-19, UNICEF says. Hello, welcome to our newsroom for having the news in details. Concerning the data of COVID-19 in Djibouti this Tuesday, 4th May 2020, we request 366 tests were performed. 4 cases positive to COVID-19, 27 cases cured after more than a month of epidemics. The balance is as follows. 14,222 tests were performed, 1,116 positive cases, 713 are confirmed cured. We deplore 2 deaths. Unfortunately, the situation of the day is in line with the stabilization of the number of positive cases. This shows once again that the healthcare staff is doing a remarkable job, which should be congratulated both in terms of early detection of cases and the search of contact persons. Remain vigilant and respect all the measures that have been taken. Moving now into another subject. Now, in the framework at the COVID-19 epidemic, a Chinese team of experts, doctors, went yesterday to the regional hospital of Arta under the tutorship of CNSS. Arrival last Thursday. They are greeted by the hospital director, the regional prefect, and the president of the regional council and the doctor in place at the hospital. The team of experts is composed of 12 doctors specializing in various fields, including infectious disease, general surgery, epidemiology, respiratory disease, and other diseases. Very experienced in their field, they have fought at the first front on the fight against COVID-19 in China. These experts will stay for about 10 days or share with their Djiboutian counterparts experiences in responding to the pandemic. The arrival of this Chinese team of experts to Djibouti is a perfect supporting station with China backing Djibouti in the combat against COVID-19 and a new proof of friendship and solidarity between our two peoples. It is to be noted that the Chinese team has taken up this time in the same aircraft a lot of medical materials to offer to the Djiboutian. And now the survey on the prevalence of the COVID-19 pandemic in Djibouti city was conducted in the commune of Balbala. We were able to follow the teams to the neighborhoods of Hayabli and Warabale, where the investigator conducted nasal and oral swabs and a sputum collection. The survey will cover the entire population over 6 years old in Djibouti city. 1,500 households with a total of 7,200 individuals. The results of this survey will provide policy makers with the factual, epidemiological, and statistical basis for the management of the national response plan against COVID-19. This survey will enable the government to assess the impact of containment on the dynamics of the disease, particularly on the level of community transmission. Dr. Hamza Mohammed also expressed his satisfaction with the work accomplished. As a part of the humanitarian and social response to the COVID-19 pandemic, the Ministry of Social Affairs and Solidarity, in collaboration with the Office of United Nations High Commissioner for Refugees, began on Thursday, 2 May, the distribution of food vouchers to refugees and host population living in the Djiboutian capital. This joint operation aims to reach a target of 1,200 beneficiary households living in a precarious situation during this period of health, social crisis. Social workers accompanied by UNHCR staff have gone back to the capital's neighborhoods to distribute the voucher to the households. Now, as part of the social assistance activities and program for the blessed month of Ramadan, the Abu Ahmed Group distributed this morning about 400 food baskets to the poorest family in the locality of Asansan, Ulama, and Korangar in the region of Tajura. The distribution process was supervised by the Deputy Abdu Kamil and Sub-Prefecture of Korangar, Mr. Ahmed Mohammed Ali, in the presence of representatives of the donor. The families benefiting from this humanitarian gesture received sacks of rice, sugar, and flour, as well as oil, dates, powdered milk, tomatoes, and pasta, etc. This project is part of the annual charitable activities of the group Abu Ahmed Abdurrahman Taha during the months of Ramadan to accompany the steps taken by the government of Djibouti to improve the living conditions of the most needy groups in Djibouti, especially in the interior of the region. Moving now on the international news, millions of children in the Middle East and North Africa are at risk of not being vaccinated against polio and measles due to the COVID-19 pandemic, which has disrupted immunization campaigns in the region, UNICEF has alerted. The United Nations Children's Fund, UNICEF, said most countries in the region are continuing their routine immunization campaigns with strict measures to prevent the spread of the new coronavirus. But some vaccination campaigns have been suspended due to the mobilization of medical personnel in the fight against COVID-19 disease, according to the UN agency. As a result, 10 million children under the age of 5, or 1 of 5 children, are at risk of not being vaccinated against polio, UNICEF said in a statement. Nearly 4.5 million children are under 15 years of age are at the risk of not being vaccinated against measles, according to the same source. This is it for this edition. Thank you for watching us and have a wonderful night.